On Thursday, Medicare Open Enrollment begins. It's the one time of year new Medicare patients can enroll while existing ones can make changes to their plan.
That's right. Here with the important details, Toni Corbin. She's the Vice President of Operations for Southwest Medical. Hi, Toni. How are you?
Hi. It's good to see you both. Thanks for the invitation.
Great to see you, too.
Open enrollment, the most magical time of the year. A lot of changes in the air. Explain what open enrollment is for those who don't know.
Well, this is a very exciting time of year for Southwest Medical Associates. As you stated, the open enrollment period starts October 15th and it goes through December 7th. And what that means is that any senior that's enrolled in Original Medicare or in a Medicare Advantage plan can take the opportunity to make changes and switch their plan so that they can find a plan that meets their medical needs.
So if they are already enrolled, will they get paperwork then sent to their house?
Absolutely. This is extremely important for all of our seniors because during the fall, there's going to be informational materials mailed to their homes. And this is going to give them an opportunity to compare benefit plans and benefit options so that they can select the appropriate plan that meets their healthcare needs. And I can't emphasize the importance of them taking advantage of the resources that are out there to help them make those selections.
No question. Well, I mean, sometimes a plan of the same name can have different things within it than maybe the prior year. They might think they're on a good plan that's right for them, but there might be a better plan out there.
Absolutely.
So how easy is it to make the change once you see that better plan?
Actually, it's very simple to make the change. So, for example, if you're a patient with senior dimensions or an Original Medicare patient, and you really would like to see a Southwest Medical Associate doctor, it's very simple to elect to make that change and select one of the many Southwest Medical local providers that we have here in town.
And so important, if you're new to this, though, to open up your mail, and it's not junk mail. This is very important for you to go through it and make the decision that's important for you and your family, really.
Absolutely. It's important for patients to look at who their healthcare providers are. So, for example, Southwest Medical has over 330 physicians today within our group, and we're planned for expansion by the end of the year to have 350 providers. We have 22 healthcare locations conveniently located around the valley and in Pahrump. And I'm excited to tell you today, you're one of the first to hear this news. In 2016, we will be taking a quality care mobile van out into the community and be able to provide healthcare services in a mobile fashion.
This is fantastic because we always see those old movies where the doctor makes the visit to you, and I'm like, I would love that. So this is an opportunity now for that to happen.
Absolutely, and we're very excited about being able to provide that service option to our patients.
And that's in 2016.
2016.
Fantastic, just around the corner, really. Now, for people who already have a doctor from your group and they love the doctor, what do they do just to keep the doctor? Anything?
They just stay with their plan, and they don't need to make any changes.
Awesome. Now, what about people that are just entering Medicare? I know this is somewhat a daunting time for people that have been in the Medicare system for some time, but for just entering, you must be throwing your hands up saying, wow, what do I do?
Well, they're going to be receiving informational material before their 65th birthday, which would give them an opportunity to really understand what Medicare has to option and what Medicare Advantage plans are available to them.
If you're just about to turn 65, you don't have to wait until open enrollment to enroll in Medicare the first time.
No,
it's
this
when
all
you're
happens.
eligible.
Yes, this all happens before they turn 65. They'll
Gotcha.
be getting all that information mailed directly to them.
Awesome. And you mentioned the date again is October 15th?
Through December 7th.
So you must make a change or keep your plan in that time frame, because what happens after that time frame?
During that time frame, they're not able to make those changes, so it's extremely important for them to make their decisions during this open enrollment period. And again, there are those resources available, and we're going to be providing them with the phone number so that if they have any questions, they can contact this phone number and they will have the help they need.
Absolutely. The number's there on your screen if you want some more information. And Southwest Medical, if we want to be a part of your network, how do we do so?
Just simply contact that number and they will receive directions on how they can select a primary care provider with Southwest Medical Associates.
Excellent. Toni, thank you so much.
Thank you, Toni.
Thank you.
It's great having you. Again, the annual and open enrollment period is October 15th, runs through December 7th, rather. This is the time for seniors to make changes to their Medicare or Medicare Advantage health plan and to select a primary care doctor from local providers.
To learn more about Southwest Medical and its locations across the valley, check out the website on your screen. Before